Good afternoon and welcome to the first panel discussion we are hosting during this year's EC DataWorks conference. As we continue to explore what it means to build resilient data analytics, we're going to really talk a little bit about what it means to really measure success for something like a data system. Today, we're going to hear from our federal staff and their perspectives across multiple federal program agencies. They work with all states and territories and are representing multiple states, territories, and the work that they do across agencies today. Before we dive into this discussion, I'm going to frame the conversation based on what we've heard from U.S. states. As someone who's worked with states through many federal, state, and philanthropic grants to develop an ECIDS, we've seen the excitement and the potential that get put into grant applications, and then how it meets the reality of grant implementation. From SLDS to the Race to the Top Early Learning Challenge, PDG B5, and others, we know that many states are really excited and eager to see an ECIDS developed. But this takes time, and this takes relationships across state agencies, new partners with often staff that are turning over. To put this into context, no state has fully integrated all early childhood programs that they intend to include in ECIDS. But there are many states that have 2 or 3 agencies working with 5 to 10 programs. So this work might take time, and it is evolving as we've discussed earlier this week. But we want all the teams to feel good about the progress you've all made in the last 10 years, and the incredible work that you've done, the relationship building that you've had to do, and has been successful across many of your state agencies. So today we are thinking about what it takes to measure and demonstrate success. How do you measure that? How do you use it to manage expectations with your stakeholders, of your grant officers, and others who are part of this conversation? So things to consider as we're thinking this through. Have you been defining success? Are you looking about whether you have an operational system, whether you have all the data in your system, whether you have a certain report? What we've really tried to do is consider and work with you all to share that having an ECIDS shouldn't be the goal, but using the information to inform program and policy decisions is really the outcome we are trying to achieve. Is it really going to lead to better decisions for children and families in the programs that we serve? But how do we measure that? So this panel pulls together 3 of our topical strands that we've talked about this week. As we think about this, let's talk about which each of these things might want to be considered as we think about defining success. So you've heard a lot this week that this takes time. It's an ongoing journey. Having an ECIDS will not ensure that it's going to be used as intended. Many of the states you've heard from today and this week have shared their stories about that. So it's important to consider the milestones along the way. These are typically things that you want to consider on quarterly or annual basis. What does it mean? What does a milestone look like for something like this, these really large data system projects? This is really important because, as we've learned, stakeholders can be hard to engage for long periods of time. Other states can share that they've pulled together stakeholders early and they didn't have anything to share for years. And that can be really frustrating for your stakeholders. So consider ways to engage in non-technical relationship building activities such as use cases to gather their information needs, putting them on governance groups to help prioritize those needs. And there's many other ways to consider this work being done. That highlights the changing priorities we've talked about earlier this week as well. If you wait to have a system, by the time that you have an operational system, the priorities are going to be different. And so building small parts and phases will help the work to be seen as successful. We always say, look for the low-hanging fruit. Many of you say that as well. But really, what we've learned is that it's not just the low-hanging fruit. The low-hanging fruit is often the things that are easiest. But what we've seen have the greatest impact on your progress and measuring success is what has had the greatest impact on your decision makers. And you've defined that in lots of different ways. Some states have decided that their decision makers and critical priorities might be their state agency leaders. Others have focused on their policymakers. Others have focused on families. And there's no right or wrong intended audience here, but really measuring success means meeting the needs of those folks along the way and talking about when each of them are going to have their needs met. So it's really important to think about those changing priorities and the design systems that kind of build in phases towards that outcome. We'll talk a little bit more about that as we get into the conversation with our panel today. We also heard about positioning the ECIDS to be used by these intended users. So it's really about thinking through how have they been able to make this information actionable and taking this into their decision-making processes. We are fortunate to build these relationships with so many of you who are leading the ECIDS work. And at some point we've said, let's make sure that this ECIDS is not something that is owned by you as an individual or your agency, but multiple agencies with multiple people. And that is a really hard thing to conceptualize and put into practice and measure, but that's what helps it going to be sustainable long-term. And so that's really important for us as we consider this conversation today as well, as what does it mean to be sustainable? That's really about how do we position the work of the ECIDS to continue on. And as you're thinking through how you define success, consider, do you have your milestones ready? Are your stakeholders continuing to participate? Are they engaged? Is the ECIDS being developed in phases that are adaptive to changing priorities? Is your ECIDS positioned to live beyond any one person or one agency? So if this topic is something that you're interested in and you want to learn more after today's discussion, there are state partners who have shared their experience in 3 different ways. One is in a podcast. You can hear their examples from other states who have already kind of wrestled through this issue and thought about what it means and how they have defined success. I encourage you to check that out. The second is on a blog called Do Your Analytics Deserve a Gold Star? This is a fun and quick way for you to think about this work. Often that can be something that you share with your teams. The third resource that we developed in the last year around this topic is really what we're calling the Early Childhood Integrated Data Analytics Self-Assessment Rubric. And this came out of a need in this exact conversation with some of you who are further along in your ECIDS development. And you realize that there's need to kind of not evaluate your system, but to really understand if it was meeting the intended purposes and how do you measure and communicate that out to others. As you were thinking through grant objectives last year and others, you guys needed something to be able to communicate that quickly. So we took some time and worked with a handful of states across the country to develop this tool. And I'm going to actually pass it over to Phil, who's going to spend a little bit of time explaining that in case it's of interest to anybody else.
Great, thank you, Missy. As you and I and the team began working on this tool, we were motivated by a simple question: how do we know if we're making progress? How do we know if ECIDS is informing actions and improving services, experiences, outcomes for children and families? And there are many great resources that exist for teams developing ECIDS that can help in the self-assessment and planning to improve the overall system. The SLDS toolkit, the 10 fundamentals, and other materials are helpful as you think about charting a path for improving the system. So this ECDataWorks Data Analytics Self-Assessment Rubric is a new resource that focuses on the process of translating ECIDS data to information and action. And that process typically involves the design and development of an analytic tool. What is an analytic tool? A tool includes a wide range of applications and formats for communicating data. And it can include a wide range of audiences and uses, such as community planning and development, for quality improvement, for program integrity, for strategic planning. And so we convened a group of ECIDS leads from several states, received input on the potential utility of something like this, right? Which would provide indicators, and then based on that feedback, sort of think about where are states in the development of their analytic tools. And we've also included here some key considerations for thinking about how you might use this tool. So it's intended to be used in a few different ways, certainly as sort of a formative evaluation tool as you think about where you are in your development of the system and improvement of your reports. It can be used as a way, sort of in a summative fashion, to look back on some of what you've already created. We'll go to the next slide, Howard. Just quickly step through some of the indicators that are broken down into 2 areas. So we have the tool indicators. Again, I'm thinking about a data analytic tool such as a report or a dashboard or a web application. For these, we have a number of indicators that are tool specific and could be filled out separately for every single data analytic tool that you've produced, websites, reports, or if you have sort of version 3 come out, you might consider going back again and seeing how you would rate yourself. Your team's intended to use this for each of the indicators. The second set of indicators, Howard, are those that are not tool specific. These are the state indicators that look more at the overall capacity for developing analytic tools. And so this one will allow you to sort of understand what is the potential, where are you as an organization, as a team, and being able to think about developing some of these actionable and informative data tools. And I just want to make two quick final comments, and then I'll turn things back to Missy. The first is that this was a very challenging activity for us to come up with a set of standalone indicators that measure progress and success in developing innovative analytics for an ECIDS was a little bit of a challenge, because data are always contextual. And so these indicators are really a guide for you to reflect and to think about sort of how these tools were developed, are being used, and where they can go next. Yes, it's challenging to appropriately and accurately define ECIDS success, but the last point I'll make is to encourage you, please don't forget to take notice of all the small steps of progress that you're making. And we hope that this conference is an opportunity for you to reflect and to celebrate the things that have been accomplished in your state or by others across the country. And I also look forward to hearing more from the panel on this topic of defining success. Thanks.
Thanks, Phil. So those are just a couple resources to check out, and they might be helpful. We'll put some in the chat box for you if you're interested in finding out where they are directly. But those are just a couple as we get started with this conversation to be aware of. I am thrilled to be able to now introduce today's panel. So I'm honored because these are for many folks, people I've worked with for a long time who are really dedicated, federal staff who really want to see these ECIDSs work. And they each work within their program office and across agencies to support the use and integration of early childhood data. So we are joined today by Jessie Escobar, who is a data analyst with the Office of Head Start. He's focused on data-related initiatives, including data privacy with Head Start programs, and has supported ways for the Head Start programs to securely share data with an ECIDS. His colleague, Dr. Lindsey Hutchison, is a senior policy analyst for the Office of Head Start. She co-authored the 2016 report, The Integration of Early Childhood Data, State Profiles, and a report from the U.S. Department of Health and Human Services and the U.S. Department of Education. She's worked to make sure that the revisions to the Head Start program performance standards in 2016 supported Head Start's involvement in the ECIDS. We're also joined by Dr. Nancy Sharkey, who is a senior program officer leading the statewide longitudinal data system program at the U.S. Department of Education. She has worked to make sure that the early childhood data systems are supported, leveraging the work that's been done by the SLDS grantees, and to ensure that the Common Education Data Standard includes relevant early childhood information. Dr. Meredith Miceli is also joining us today, and she's an education program specialist with the U.S. Department of Education, Office of Special Education Programs. She leads the Center of IDEA Early Childhood Data Systems, also known as DAISY, and was a critical partner in the development of the early childhood data in their Common Education Data Standard, and works closely with other offices to ensure that data on children with special needs are included in the ECIDS. Mr. Richard Gonzales is a preschool development grant birth through 5 project manager from the U.S. Department of Health and Human Services, Administration for Children and Families within the Office of Child Care, and has been a strong advocate for this work for a long time, and is really here to share some of the perspective on the systems level. And then Mr. Kyle Peplinski, who is the branch chief for policy, data, and technical assistance coordination with the Division of Home Visiting and Early Childhood Systems at the Health Resources and Services Administration over the last 6 years, has been working with states and territories to ensure that home visiting data is of high quality and able to integrate into an ECIDS. So thank you all for being here. We're really excited to get started. We'll start with the first question, which is, why are federal programs interested in supporting integrated data systems? And I'm going to maybe ask Lindsey to start us off today.
Thanks, Missy. I'm really happy to be here with everyone today. And just a quick caveat for me, I do have 2 little ones at home right now. They're currently upstairs. I also have a dog right here in the same room with me. So I don't know what noises you might hear while I'm talking. But so in terms of our interest in the Office of Head Start, as I'm sure everyone here today knows, Head Start is the Head Start program is a federal to local program, unlike most other federally funded programs that typically pass through the states. And so the Office of Head Start recognizes that this makes it a little trickier when thinking about how to integrate Head Start data at the state level with other early childhood data. And we also recognize the importance of Head Start programs being integrated into and collaborating with other early childhood state systems. And we do really encourage this, including data systems. So from our perspective, participation by Head Start programs in state early childhood data systems can really reap benefits both for local programs and for states, such as the local programs being part of the conversation on state early childhood policies, both during their development and implementation. And we realize it can help states to craft policies based on a better, more complete set of information about the kinds of services and experiences the children in their state have, and can also provide great new opportunities for coordination of our local Head Start programs with relevant partners at the state level, and create opportunities to increase the capacity of their own internal use of data and sharing of data in appropriate, relevant ways. So I'm going to leave it there and turn it to another federal colleague to address this question.
Hello, everyone. Okay, go ahead.
Hello, everyone. This is Meredith Miceli from the Office of Special Education Programs at the U.S. Department of Education. Our support of ECIDS has been for a number of reasons, kind of at the most basic level, really focusing on the opportunities it provides to improve the quality of data on infants and toddlers and young children with disabilities. That is collected, reported, and then used by the federal offices, the states, the programs, and as well as the public. So we see the data integration process as a way to cross-validate those data that are collected from various programs in order to arrive at valid responses and high-quality data. Additionally, as you have heard a lot about already in the panel today, just the opportunities and possibilities as far as evaluating the programs and services for infants and toddlers and young children with disabilities, as well as their outcomes and performance. So these systems offer the opportunity to drill down and get more information on those children that are receiving these services, as well as the other programs for which these children are participating in, and looking at kind of where are we getting the best outcomes and experiences. We also believe in the efficiencies that these systems create. So leveraging those relationships, the resources, the technology, experience, and skills across programs and agencies to allow for easier reporting of the Part B and Part B preschool and Part C data. And finally, we support this work because we are interested in making sure that those early intervention preschool special education program folks are at the table for the discussions, the development, the management of these ECIDSs. And that an open exchange and communication is going on between those programs and those that are governing or managing these systems. So I think with that, I will hand it off to the next person.
Thank you, Meredith. Hi, everybody. My name is Kyle Peplinski, and I'm here representing the Maternal Infant and Early Childhood Home Visiting Program, or MICV, as I'll refer to it. And I think most directly, from our perspective at the federal government, we're interested in supporting integrated data systems because we have a statutory mandate. So that makes it a whole lot easier. So when the program was reauthorized in 2018, there's specific statutory language included to develop data exchange standards and support data interoperability between home visiting and other early childhood serving programs. So that's sort of the short and quick answer, but the longer answer is that we really see the benefits of including home visiting and broader early childhood data integration efforts for many of the same reasons as you've already heard. I think the opportunities to first and foremost, reduce data collection burden by sharing data, data collection burden from families and from home visitors who are doing the work and who don't get into the business of home visiting to collect and report data, but to really work with families. So that's high on our priority list. And then secondly, to really ensure that we have data across a continuum of services and across a multitude of different families to really be able to answer some of the most pressing policy questions that are facing the early childhood field right now. What services work for who and under what contexts? In order to answer those types of questions, you really need cross-system and longitudinal data that's found in these integrated data systems.
I'll go next. Hello, everybody. I think that basically the integrated data systems will lead to just more efficient use of resources and more effective leveraging of those resources. We at the federal level want to see family community responsive reporting so that information data that we're collecting, not only are we better at making the decisions at the federal level, but more effective at the state level, and then parent voice and parent inclusion, parent understanding of the data being collected can help inform the services that need to be provided. Within the PDG Birth to 5 grants, there are two things that are very specific. One, we are supposed to, states are supposed to try to move to a better able come up with a distinct count of children served and unserved. And right now, we're just not able to do that I don't know if we're able to do it any place, but certainly if it is, it's very few places. And so the idea here is how do we get better at knowing with so many services available to children and families, how do we get better at knowing what the exact number of children being served by any particular program is? We also have an effort underway that has to do with coordinated application eligibility and enrollment. And this idea of parents applying once and then having all of those services assessed at the same time. If we have a coordinated data system, we have a better way of sharing information across all of our programs, that would allow states to more effectively be able to do that. I will stop there and pass it to someone else. Thanks so much.
Hi, this is Nancy Sharkey. I think I'm next here. Yeah, I want to just echo a lot of what Richard just said, that a big reason why we focus on having integrated data systems is to ensure that we're being efficient. It doesn't make any sense for people to develop one system that doesn't talk to another system, especially when we're trying to support families and kids as they move through the entire, education pipeline. But we also want to be able to support them as they move through that pipeline. So it's not just efficient, it's the right way to do this work so that folks can really see how kids are doing from the beginning and try to figure out how we can evaluate our programs to make sure that we're providing services that really support kids and their families as they develop.
Thank you all. That's there's a lot of interest, right? And there's a lot, I think, very commonalities here about why this is a really important thing. And the idea that while we are investing in program data, the idea that it's also important that that program data be able to integrate into other systems to help when often the families are being served by multiple programs is really important. I think that's a theme you were all hitting on. So thank you for sharing that. And it's great just to even see that you all are working together across agencies on this topic, because I think that even just demonstrates from a federal level the investment made there. So as we move into the next question, and I don't know, before we move into the next question, anybody want to respond to something that anybody else said on the panel? Okay, well then we'll move to the next question. What might success look like if states have an ECIDS? So we introduced this whole discussion with having it is not the goal. So what is it then? So what does that look like? And I'm actually going to pass it over to Jessie to get us started.
Thank you, Missy, and hi everyone. So happy to be here with all of you. What might success look like if states have an ECIDS from the perspective of Head Start? So a successful ECIDS would be inclusive and intentional in how Head Start programs are brought into the fold and in providing benefits to local programs for their participation. By being inclusive and intentional, a successful ECIDS would recognize the vulnerable populations served by Head Start programs. For example, a local Head Start program might be designed and specifically recruit families in extreme poverty, children of incarcerated parents, or families experiencing homelessness. And it is important this context is not lost when comparing Head Start data points to other early childhood settings and when reporting Head Start data to state policymakers. A successful ECIDS would ensure Head Start programs have full confidence that their data will not be misused or misconstrued. By being inclusive and intentional, it also means that Head Start programs are engaged throughout the process of integrating data, and they have a clear understanding of the purpose of the data integration, the benefits to their Head Start program, and the steps that they can take to support integration, which takes into account their capacity to do so. And as I alluded to, a Head Start program would see specific benefits from their participation in an ECIDS. This might include sharing data back with the program on the other types of services their enrolled children and family receive, or providing technical support to the program to assist them with data sharing, which also has the added benefit of building the program's own capacity with data. Lastly, a successful ECIDS from the perspective of the Office of Head Start would be one where the Office of Head Start could ask a Head Start program about the purpose and benefits of the data integration, and a program would be able to articulate and speak to that very easily. And that is, I think, something that what success might look like in ECIDS from the perspective of the Office of Head Start.
Jessie, I could easily just say ditto because I think you actually talked about so many important things. But I think also, I mean, I would expect to see a lead agency with cross-agency data sharing agreements. I would expect them to be working on strategies to address common challenges. They probably would have established common data priorities. But all of these things would be for the purposes you've talked about, for being able to support data users, to have better data tools, to create better alignment and coordination, and be responsive to a diversity of perspectives. This obviously would lead to better decision-making and the ability to draw down data as needed, which certainly we became even more aware of as a need when COVID came, and how many people did not have data available and are now, needing to do that. So I think we'd be better able to draw down data and to share it across organizations.
Anybody else in the federal panel want to respond to this question? Okay, if not, I actually have a follow-up question for Nancy Sharkey. So part of success is the ECIDS and probably a connection to the SLDS. So what could they be looking for as a partner or leverage the SLDS? What might that look like?
I'm sorry, I think I was muted. When we're looking at an ECIDS and looking at a successful implementation with an SLDS project, it really means that the state has come together to figure out what questions it wants to answer and what policies and practices it wants to inform as a whole. So we're not just looking sector by sector, but we're looking at the whole picture of what happens to kids and their families. And what it looks like operationally is the sectors have come together. They have shared questions they want to answer. They have a data governance system that really supports coordination and data sharing across sectors. They've involved the stakeholders from all of the groups and not just specific groups of folks who might be associated with just one smaller piece of the pie. So I think when we're looking at success, we're looking at a broad array of stakeholders and questions that are designed to really help the state move forward as a whole.
Helpful. Thanks, Nancy. Okay, so let's go to the next question I think everybody's eager to hear about, which is what are the federal program offices doing to support data across early childhood programs, including any work that's being done to collaborate across federal programs and how that might look in working with the states? So maybe I'll have Richard, do you mind starting us off here?
Sure, thank you. Well, I think first of all, one of the things that we're trying to do is provide better TA across all of our departments. We're looking at where technical assistance is really important to help the states move to the next steps and wherever they are in their development. We're looking to align our needs assessments. We're looking to coordinate and co-create our funding announcements. We're looking to share data reports with one another, and to work together related to the common tasks we have at hand. We are actually trying to not only work more effectively with each other and across our offices, but in doing that, we're trying to model the behavior that we want states to be doing as well. We're trying to help states to think about who are the partners who are not sitting at the table. We're introducing them to people they may not know. So a lot of times they know the programs, but they don't know the individuals. So what we're trying to do is even identify who they can touch base with in their states. I think that the idea here is for us to listen to what the states need, have conversations with them both in groups and one-on-one, give them networking opportunities to talk to one another, because that's what they really want to have the opportunity to do. And I think we've been doing that more and more, particularly with our PDG Birth to 5 grant. We've had a number of opportunities where we've allowed states to talk to one another. And then this idea, again, of listening to them and figuring out how we at the federal level what other supports could we provide them that might be useful to them.
So once again, I feel like following Richard is the way to go because he said a lot of what I think we would say is important in terms of how we're supporting states. A lot of what we do in the SLDS grant program is just, support states based on where they're starting, because they submit applications that propose projects that are relevant to their states. Obviously, there are cross-cutting issues, but it's really a state-driven grant program. And then we help them get where they want to go. And sometimes that means collaborating with groups like PDGB5 to make sure that our TA is aligned and that folks from the SLDS grant programs know who their counterparts are in other programs. We also work quite heavily on the Common Education Data Standards program, which is specifically aimed at trying to help states think about how to integrate data from different sources by creating common definitions and a shared vocabulary, which helps bring the states together and to bring the data together. So, in the Common Education Data Standards, for example, more than 20 states were involved in helping to develop those early childhood standards, which I think gives a sense of our efforts to bring states together to have conversations, but also to take the lead from states when they know what they need. And our job, a lot of the time, is to facilitate those conversations and capture what they're saying so that we can provide information back in a way that makes sense.
Boy, I couldn't agree more with what Richard and Nancy just said, so I won't repeat what they said, but just associate myself with their comments. What I'd add to that in terms of what we're doing as a federal office to support this work is, we aren't going to solve the individual problems of every single state that they're facing around this. One thing that we do have is convening power. And so we've worked really hard to bring home visiting programs and their state level counterparts across early childhood serving programs together to really identify what are those priority use cases that they want to use to start the conversation around integration of home visiting data into broader efforts around early childhood integrated data systems. So, I think we've had some success in sort of bringing, identifying what those priorities are, how home visiting data can contribute to these larger efforts, and what the benefit of having home visiting programs involved is.
And I will add to that from the perspective of the Office of Head Start. So Our perspective on this, since where we can give support, is a little bit different, again, because our grantees are the local programs as opposed to the states. So as everyone here probably is well aware by now, a really big accomplishment and support for us in this space was our revisions in 2016 to the Head Start program performance standards, in which for the first time, the Office of Head Start included a framework for protecting child privacy when disclosing data from child records to other entities. And we also added a very specific standard that encourages our Head Start programs to participate in their state data systems. And we clarified that they can do this without parental consent if they choose to, though they have to still notify parents about that data sharing activity, and they can choose to get parental consent if they want to. So this, including those in our standards, took a lot of effort on the part of Office of Head Start, and we were really excited to include those things in our standards, which is now about 5 years ago. We also recognize that since the publication of the revised standards in 2016, some of our grantees are still hesitant to share data. So I think an important role that we play is on an ongoing basis, the Office of Head Start is available and willing to help build connections between local Head Start programs and an ECIDS and the appropriate state agencies, including through participation such as this one, and through discussions with other individual interested states or programs. We specifically supported a few states last fall by participating in discussions directly with their Head Start grantees in their state about the benefits of integrating data with the state. So we recognize it can be really helpful for our grantees to hear directly from the Office of Head Start about these issues and gain a better understanding of what's allowable in our regulations around in terms of being able to share data. And as needed, we also address individual questions from programs around sharing data, such as when it's permissible or not, with or without parental consent, which privacy laws or regulations might apply to particular data elements they want to share. So that is a lot of the work that we are doing on an ongoing basis.
And so now, so I think from the OSEP perspective, the thing that our most significant piece of support is through our technical assistance investments. And we have two right now that really focus on data systems and data integration. And so OSEP funds the IDEA Early Childhood Data Systems, the Center for IDEA Early Childhood Data Systems, or DAISY, to enhance, streamline, and integrate child-level early childhood data systems to address critical policy questions, facilitate program improvement, improve compliance, accountability, and improve those results for children served under Part C and Part B preschool special education programs. And as I might have noted before, they help Part C and Part B preschool programs participation and engagement in the ECIDS work that's going on within states. So assisting them with coming to the table, being able to actively engage and participate in those conversations. So those are some of the technical assistance services that DAISY offers. Additionally, they've developed a data systems framework, which is to assist Part C and 619 programs, or the preschool special education programs, in developing and enhancing high quality state data systems, and to improve the overall quality of those IDA data, though many of the aspects of this framework can apply to other data systems as well. So it includes things like purpose and vision of the data system. It actually includes quality indicators for these things: purpose and vision, data governance and management, the stakeholder engagement, just to list a few. They also have compiled a list of critical questions for which a high quality data system, state data system for early intervention or preschool special education should be able to answer. And though some of these questions are very much focused on just a Part C or early childhood special education data system, there are some that would require the data across programs, so from an ECIDS. And then we also fund a Center for the Integration of IDA Data, or CID, which is really focused on Part B. So that's going to be the children with disabilities ages 3 through 21, and the integration of that data into the statewide longitudinal data systems. But they do work directly with states to resolve challenges around fragmented IDA and SLDS and data management practices and data system architecture. And they also have a data integration toolkit that supports these efforts. It outlines major steps and supporting tasks that are required to complete data integration processes. Again, it's from the program perspective, though a lot of the information included in there could be used across programs in data integration work. And so in addition to funding the technical assistance and OSEP, we also engage in our stakeholder and the Common Education Data Standards work that Nancy was talking about before. We work closely with Nancy and her colleagues and NCES regarding the work around the support for the integrated data systems and the inclusion of the early intervention and special education data into them. I think that's it.
Okay, anybody want to respond to something anybody else said? Or any other resources you want to make sure? I'm kind of putting them in as you're mentioning them if I can find them fast enough, but if there are others that, I'll put them in. And as we get started, I think something that Nancy mentioned that I will put in the chat for everyone is also the CEDS and the link to the SLDS resources. So I'll do that as we get started on the next question. So maybe unless anybody wants to respond, I'll pause here.
Missy, I would just chime in. Someone had asked in chat about the references to the standards I mentioned for Head Start programs. So I put links to 2 different parts of our standards related to data privacy and encouragements to share data. They're kind of separated though in the chat by other messages.
Yeah, sorry, I was chatting other things, Carrie, as you were jumping in with your questions. So thank you. Anyone else want to respond? All right, well then we're going to go to the next question, which is how do you hope states will integrate data to support systems building efforts? And as Richard has already mentioned, especially during COVID, we saw a lot of grantees move up or escalate timelines around some of their data system work. So maybe we can start, Nancy, if you don't mind starting us off here, and then I'll fill in some of your resources as you start talking.
Sure. So as we were kind of discussing before, one of the goals of these projects is to really build systems that use data, not just as individual agencies, but all together. And, identifying stakeholders, policies, and practice you want to inform, the questions you want to answer, and the data that you'll need. So we've seen a lot of states come together in interdisciplinary early childhood groups to figure out what questions they wanted to answer, including on things like family and health, access to programs, program quality, child outcomes, and even workforce outcomes for families whose kids have access to services. When you talk about COVID, I think a few states have really gotten into helping support states' efforts to locate early childhood spots, early childhood education and childcare seats, in some cases just across the state to try to figure out where there were still centers that were open, but also to help identify where there were childcare seats available for first responders so that they could work in the hospitals and doctors' offices while their kids could be safely cared for in childcare spots. We've also had states that are now trying to figure out which kids were expected to be in publicly funded early child care situations or early childhood education, but didn't, as the pandemic started, show up in those spots. And they're trying to figure out what the implications are for education next year for the kids who they thought would be there, but now are going to be coming in a year later than the states thought they would. And again, just having a data set and stakeholder community that really sees the big picture in terms of using data to support the needs of kids and their families is critical in the situation.
So I could go next and answer this for the Office of Head Start. So for the Office of Head Start, we hope that states work directly with local Head Start programs to build on and go beyond facilitating data integration, but also use it as an opportunity to help Head Start programs to become more knowledgeable and empowered with data integration activities. So prior to 2017, many Head Start programs were hesitant to engage in data sharing activities that was not directly with the Office of Head Start, but we have been working on with grantees so that they can better determine which data sharing activities would be beneficial for the families they serve and how to do so while still protecting the privacy of child records. And programs vary in their capacity to share and integrate data, as many of you are likely already aware, but we see the ECIDS as a great opportunity to help pave a pathway forward for Head Start programs in this space. For instance, many of our programs would benefit from sharing data with other social services and health programs in their local community. But if both the Head Start program and the local partner is hesitant or unsure how to move forward, this can prevent a data sharing activity from getting off the ground. In general, we believe state agencies overseeing an ECIDS have more capacity to support a local Head Start program as they share data with the state, which could in turn catalyze the Head Start program to engage in other appropriate and helpful data sharing activities.
So one of the things I wanted to mention is that the differences we've seen with states who had already created these strong partnerships and had already begun to try to figure out how to share data. They were much farther along when COVID came into play, so that you saw a much quicker response to mapping where services were, where gaps were. They're mapping hotspots where people are being vaccinated or not being vaccinated. They're able to pull up data really quickly. And one of the things that we heard from some of the states who were not as far along or who were having trouble getting partners to sit at the table to coordinate or to figure out ways to integrate data, share data, is that some of these partners came to the table more quickly now than they had in the last 2 years. That they all of a sudden, the emergency, the need, the requests being made by their mayors or by their state leaders for data has caused people to come to the table quicker and realize the importance of sharing data and how it could be beneficial to all partners. So what I'm hoping is to see states having recognized that now, who were less far along, who can begin to work together, if they haven't already, on establishing the governance and data sharing agreements, streamlining some of what they need to do, identifying questions that need to be asked. Because first, before they do anything else, they have to even figure out what data they should be collecting or sharing or integrating. What are the questions they need answered? And I think a lot of states right now are having those discussions to try to figure out what questions are we going to need to answer and what data do we then begin to collect if we're not already collecting it, so that we can come up with better decisions, greater efficiency in our decision-making process, and a better use of funds.
Others want to jump in. Meredith, is there anything there about the role that Part C or 619 are playing in this conversation about systems building?
So, so I think the piece I really wanted to highlight regarding this is really about having data systems that are able to tell the story of the impact of the pandemic, as well as the impact the pandemic has had, well, on the children, but then also on the data. This is something that we're very interested in collecting at OSEP, having and understanding the story, the impact, the recovery of the children after this pandemic has passed, when it has passed. So I think that's the piece that we are most interested in at this point. And I think we're looking for, I think states are looking for sources of data to be able to respond to this request, and then be able to in the future respond to these kinds of emergency situations when they arrive.
That's helpful. Anybody else want to respond to something anyone said? Well, I think it's helpful, and as Richard pointed out, it's been great to see you all as states be able to respond to these times. And if you had something in place, even if it was just something small to begin with, it gave you something to launch from when COVID hit and you needed to start responding to emerging kind of questions. And so we know that so many of you have kind of pivoted the work you thought you were doing in 2020 and began doing other analytics and other integration with new resources and new partners that you may not have worked with prior to this. There's so much happening there. And so really just, I think you guys are doing such great work. And so as you're thinking about success, even your ability to pivot that quickly, I think is incredible. And so capturing that, I think, is a really important part. So I think that brings us to the last question, which is really just something to celebrate and think about. What are you most excited about seeing? Where is progress being made? What are some of the accomplishments? What do you all think is just really exciting? Because I think sometimes we're so in the middle of building these systems and thinking about how we're building out these relationships that we need to do the systems that we lose sight of the great things that are happening. And so as we wrap up and kind of leave a note of encouragement for the states, what are the things that you're excited about? And so maybe Kyle, you can start us off there.
Thanks, Missy. A couple of things here, but I want to start off by saying, I think one of the things I'm most excited about is really seeing the promise of integrated data to better understand relationships between the services that young children are receiving and disparities in their access to services and in their outcomes. I think if certainly has been, health equity and disparities in access and care has been a longstanding issue, even made further, further realized through the COVID-19 pandemic. I think when programs have the opportunity to bring their data together to really understand a more comprehensive picture of what services children are receiving and the outcomes that they are achieving, that there's just great promise to look at it with that equity lens. And in terms of accomplishments, I think one thing that we've done from the McVie side is brought a number of awardees together in a community of practice. I know others on this panel have done similar sorts of convenings. And I just think the excitement among awardees who participate in those conversations is an accomplishment in and of itself. In a home visiting data landscape, which is very complicated and did not include a lot of integration with other programs or even across the home visiting field. Just a couple of years ago, we've seen a lot of interest and excitement about moving and a realization of the benefits of moving to more integrated data systems and more integrated data. I think there's still a lot of work to be done. We've talked about some of those issues here related to, participant consent and privacy and data sharing agreements. I think that's sort of the state where there's a lot more in the home visiting world for us to accomplish. But I think just the excitement and the willingness to sort of dig in and get dirty with some of this work has been really inspiring.
So I will respond next for the Office of Head Start. So we are really excited about seeing our local Head Start programs across the country embrace data sharing and integration, and also at the same time building their own internal capacity around data. And I know that Jessie and I have said that many times, but it is something that our program really varies across our programs in terms of their own capacity to use data. And from the Office of Head Start, we've been really strongly emphasizing the importance of them using their own data in a variety of ways for continuous improvement. And so we hope that states will view their state early childhood data systems as one great way that data can be used for early childhood improvement. And we really like to hear the stories of success in various states, either from the perspectives of our local Head Start programs or the perspectives of states. Jessie and I have heard a number of stories, both from things that Missy has shared with us, that we've heard directly from grantees, directly from our state partners. We've heard great stories of states making really, really good efforts to really accommodate our Head Start programs and help them be able to share their data in a way that places as minimal burden on them as possible. I forget which state it was, but they told us how they had a staff member they hired specifically to drive around the state and get the data from every program to go around some of the technical issues they were running into with some of the programs. So that's just amazing to hear that kind of thing. And we know that it looks different in every state because some states have a huge number of Head Start programs, whereas others have a much smaller number. So we really believe that successful data integration for our Head Start programs can really open up the possibilities for them with data use. So that's the thing that excites us most.
So I feel like I have just some data to share that is one of the reasons I'm so excited. Back when we started kind of assessing states' capacity to link early childhood data with K-12 data, it was about 10 years ago, and about 10 states said they had that capacity. And now 10 years later, it's about 40. So that's an enormous jump just in basic capacity to link data. But I think what makes me more excited and excited to work on the SLDS project in particular is we get to see states really using these data the way they want to use them. So one state, for example, built an evaluation, a toolkit that looks at evaluation capacity and data use of local early childhood programs. So really focusing on helping people use data. Another state focused much more on trying to figure out the distinct count of kids receiving early childhood services and including information from their health agency so that they were looking at, things like birth records and recipients of child care subsidies and recipients of WIC benefits and services. So really trying to pull together a picture of all of the services that kids are receiving. And then another state looked at how their kids are prepared for kindergarten. So much more of the education flow use of data to see what a kindergarten readiness report would look like and bringing in data from their early childhood systems. So I'm really gratified that states are finding ways to use these data in ways that make sense for their local needs. And frankly, I'm also really grateful for increased collaboration across federal program offices so that we can all have a better sense of what states' needs are, and so we can do a better job of providing support for all of them.
So I think there's so many things here that I think states are making progress on that I'm excited about. I mean, one of the things is that, first of all, some states are creating positions for data sharing and integration. Some are, creating new technology instead of migrating their legacy systems. They're not just relying on contract. There were a number of states that were just relying on contractors to do their data collection or their data decision making. And now we see more states taking ownership in figuring out how to design and build and maintain and analyze and use the data that they collect. There are some states that have data champions. There are some states that have data governance bodies, and we're just seeing the numbers of states increasing with these examples. You heard me mention before, and I find this really exciting because I don't know how to do it myself, but that's creating these data portals and dashboards and mapping mechanisms that allow you to see in the moment what's happening and what's not happening in different communities. So these creation of these comprehensive service maps. The other thing that's happening is states, and I think this is a credit to us as federal agencies, but we're finding ways to bring states together more often to talk to one another, whether it be in communities of practice or networking sessions. And what that's doing is it's allowing people to see opportunities that they didn't see themselves. And they almost creates a competitive edge to it, right? So someone sees a state could do this, well, maybe I could do that too. And they're beginning to look, to Nancy's point, they're beginning to look at, well, that may not be something I need in my state, but there's something else here that triggers for me to begin to work on. So they're building on the successes of with certain partners that they have, like whether it be maybe they figured out how to coordinate data between pre-K and childcare, but they haven't figured out how to bring in Head Start, or maybe they figured out Head Start, but they haven't figured out how to bring in home visiting. And so they're learning from some of the collaborations and successes they've had with certain partners, how to maybe reach out and include other partners. We see more placing of families at the center of this data integration effort, the engaging of parent voice and the integrating parent input. I like to think that PDG Birth to 5 helped drives that, because one of the main activities is for maximizing parental engagement, but it was happening before. So we can't take all the credit for that, but it's happening. And it's exciting to see that parents, family voice part of the process, states realizing the need to hear from the families receiving the services. And then just building on local and regional community successes. So some states that may not have statewide efforts are finding out where successes are occurring within their state, and then trying to use those models to expand or to share with other parts of the state. And then I think Nancy mentioned this already, the idea that there's more focus on the state to teach the various people in their states, the various local and community groups, how to use the data more effectively, how to take data. I think for a long time, the early childhood community has collected data, but never knew what to do with it, never knew whether what they were collecting was really the data they needed to collect. And so there's a lot more thoughtful processes taking place where people are saying, you know, do we need the data we're collecting? Could we put that aside and possibly come up with different data that will be more meaningful to us and more meaningful to the end users as well? So those are just some of the exciting things I see happening, and I'm really excited to see where we go next.
That's great. And it's so encouraging to hear about the wins and the way you all are perceiving the success, as many of you are the grant officers over the programs that are contributing data or to the data system work itself. And so thank you for sharing that perspective. And I do think it recognizes all the great work that's being done across the country, and whether you're still in a planning phase as a state, whether you are in operational and trying to add new partners, whether you are kind of moving beyond that and really expanding your analytic capacity, there's so many different phases, and that everyone's at a different point. And as Nancy said earlier, really recognizing the state context, both to what your needs are and how these systems are going to be designed, is really important. So it's just really exciting, I think, to be able to hear that from you all as well. So thank you for sharing that. There are a few questions coming in, so we're going to move into some Q&A. We're going to encourage you as participants to chat in the box if you all have additional questions for our federal panel today. The first question that came in says, any recommendations for training resources that we can make available to our staff to help grow our organization's cross-the-board data literacy? Any recommendations?
Wow, I guess I'm thinking of, I almost would suggest that we take a look at, I think there are so many resources available within our TA center. All of us have various TA centers, and I think there are just so many resources. I'm not sure where to begin. I mean, Missy and others have been putting things into the chat recently, links to many different documents. But maybe Missy, at the end of this process, if it's not already part of it, maybe we can just put up links to certain TA websites or whatever, where people could go to look at a slew of different resources that would be specific to particular needs that each of you might have.
And I will add that the Office of Head Start, we have a variety of national centers, training and technical assistance centers that we fund, and some of them have developed resources related to data use and data literacy for our programs. Things like modules that program staff can work through, definitions of things. And so I can look for some specific links. I was trying to look while Richard was talking, but I know there's one, you can go to our website, the Head Start Early Childhood Learning and Knowledge Center. And I know there are some things up there, like there's a page I'm looking at now called Digging into Data for Responsive Programs. If I find a couple of more links from our website, I'll paste them into the chat. But they're mostly about building the capacities used internally for using data.
Right, so if others on the Thrill panel have ideas or resources from your TA centers, I think we've listed all of your TA centers in the chat box. So we have, but if we have missed any, feel free to jump in, or if you have resources specifically about that. I think what's great about the way that the technical assistance programs have been working is that, like Daisy, for instance, goes deep into the work with Part C in 619. Right, which is great because it builds the capacity of that program to then integrate up into that. The same with the Head Start programs, right? And then you have other programs like SLDS and PDJ that are kind of more systems level, and they're really working across the board to think about data literacy. So Jessica, to your question, I think a lot of it comes from, depends on who your user group is and who you are trying to train. And sometimes that means customizing to meet their needs, and there are likely many resources, but we can also follow up with some of those. And if others in the room who also have trained others on the use of data, have ideas, go ahead and throw those in as well. Oh, go ahead, Meredith.
Yeah, I was just going to say, and there are a couple resources from Daisy. Again, as you said, they are designed or developed for Part C and the Part B preschool programs, but we do, they did develop a data culture toolkit, which is supporting state and local data use. A stakeholder knowledge toolkit, so building stakeholder knowledge about the data, as well as they actually have a new one related to preparing for your next virtual stakeholder meeting as a response to what's going on with the pandemic. So there are a number of resources, and I can put those links in the chat.
Great, thanks, Meredith. All right, there's another question that's come in, which is, what can ECIDS teams do or help prioritize to help you as federal staff make the case for continued resources or more resources? Is there anything specifically that we as states can do to help?
Yes. So I think the first thing that has to happen is you need to talk to others in your state, to your state legislators, to people who make decisions in your state, and let them know the progress you're making, the difference that funding has led for you, how efforts underway, how far you've come in being able to do what you're doing with data integration, but how much farther you need to go and what resources would be helpful to get you there. We do a terrible job at telling the story. We assume everybody knows what we're doing and the accomplishments we're making. And I think what happens is, time and time again, I've heard members of Congress or other leaders say, well, I'm not sure what we got for the money that we put out there. I'm not sure what progress states are making. We need to be better at the federal level, the state level, the local levels, at talking about the successes and the differences that this make in the lives of the families and children that we're serving. So if you do only one thing, tell your story, assume nobody knows anything, and just keep putting out information about the difference that this is making in your ability to do your work and to make changes, meaningful changes in the lives of families.
Do others want to add to that?
I would add, I think for the Office of Head Start, if we were going to be talking to leadership who maybe know a little bit less about what it means to participate in a state data system or what kind of benefits it can give to programs and states, I think being able to more concretely demonstrate the benefits, particularly for Head Start programs, it sounds a little bit, I think, vague if we say Head Start programs can benefit, but what does that really mean? And so Jessie and I and others might try to, talk about it, and we'll try to talk about it in a more concrete way to our leadership, but having those examples from different states where programs have shared their data and have benefited in some way, I think is really powerful for our leadership, especially those that don't know as much, aren't as familiar with this area.
The early childhood field has been notorious for telling anecdotal stories. And what we find time and time again is congressional members and other state legislators, et cetera, want to know what the numbers are, what the data is, how do you back these stories up? And until we do a better job at that, or the states that actually do a better job at that, and many of you are those states, you found that you were able to convince your state legislators to give money to the purposes that you had. So not only were you getting federal dollars, but you were getting state dollars as well to support what it is you need to do, because you were able to tell those stories that Lindsey was talking about by using real examples and by using data to support. Here's what we now know, and the reason we know this is because we created this system that enabled us to do the following.
I would just add one other thing, which is, I think it's helpful to just be really clear about with decision makers about how you're using data and how you're protecting data. A lot of families, participants are wary about having their data shared. A lot of policymakers are responsive to those potential concerns. So having really clear communication around data privacy, consent, how the data is shared is always very helpful.
And I just want to say, Cal, thank you for adding that, because that has often been the point that has made it difficult for people or different players within the state to even be willing to share data, because they've been so concerned about the inability to protect data or to make sure that privacy is a number one factor. So thank you for raising that.
All right, those are some great questions, and we just really appreciate the panel today sharing what you all are doing, where your time is spent, how you are all collaborating together. Again, it's great to see, and I think sometimes the states may or may not know that that is actually happening at the federal level. So thank you for sharing an update on that work and how that's looking and kind of working across state agencies. So as we go to the next question, I think we've one of the panelists, so thank you, Nancy, had a great idea of combining all the resources that we're putting in the chat for you, and we will follow up so that it's a little bit more manageable, because there have been a lot of great things that we are sharing out but can probably be very overwhelming. As a quick reminder, if you're really interested in this particular topic, there is a blog, there is a podcast where you can hear directly from other states who have been wrestling with this topic. But we will also plan to follow up with some sort of summary with some of these great things that have come out from the panel discussion today. And so do be on the lookout for that. And hopefully those can be resources that you can share out with your team members as well, especially for those, I know that many of you are new to this ECIDS role. So these are some great places to start. We do not want to overwhelm, but we will also these are some great resources to be aware of. As we also, and then we have a couple here highlighted. They're also in the chat box. So we won't worry about that too much. So again, we will follow up with some of these resources. As we wrap up, I just want to remind folks that the voting for the peer awards wraps up in approximately 12 minutes. So if you have not already, maybe Howard can put the link back in the box for everyone. You've got 12 minutes left to finish voting. You all nominated your peers earlier this week for the ECIDS Progress Award, the Analytic Innovation Award, and then the ECIDS in Action or the Data in Action Award. Those are going to be awarded tomorrow afternoon after the next panel. So hopefully you all are voting and finishing your voting in the next 12 minutes so that we can get those nominees and awards ready to go for tomorrow afternoon. But with that, I really want to thank our panelists today. Thank you for spending time with us. Thank you for sharing your experience. We really appreciate it. And we look forward to any questions that others have. We can always share them up with our federal partners. If you think of something later, feel free to send it to us and we will pass it along. So thank you all for your time and thanks for being here. Have a great afternoon, everyone.